started. Woo! KidsX Demo Day. Super excited to see all of your faces. My name is Kiana Turner, and I'm the Director of Digital Transformation at Children's Hospital of Los Angeles. And I'm excited to welcome you all to our KidsX Accelerator Demo Day, where you'll hear from 7 amazing companies. And just to give a little bit of background context on KidsX, KidsX is a global ecosystem of pediatric innovators. We are backed by 30 plus pediatric hospitals in the US and around the world, all dedicated to furthering, developing, and advancing innovation in the pediatric space. Let me jump into our slides here. So a little more about KidsX. We're focused on solving the most pressing problems in pediatric care delivery and also helping develop the solutions that we want to see in the space. Hence our accelerator, our flagship accelerator, and the support that we provide to early stage companies. Our hospital consortium is our cornerstone. As I mentioned, we have 30 plus hospitals in the US and a few international as well. We do invite both freestanding children's hospitals as well as children's hospitals that are a part of a larger health system. So if you don't see a name of a children's hospital that you're familiar with on this map, please come talk to myself or one of the KidsX team members afterwards. We are always welcoming new members. And the point of our membership is really a thought partnership community. We meet monthly and talk about the issues that we're all facing at our pediatric institutions, the solutions that we're seeing in the market, and how the creative ways that we're solving those problems. So it's a meeting of the minds. It's an investment in the solutions that we want to see in the space, and really trying to de-risk this very sensitive and yet so important space in the healthcare market. So our KidsX Accelerator, our accelerator is a flagship program that we announce, that we put on every year. Today you'll be hearing from our 4th cohort. KidsX was founded in 2020. And the point of our accelerator is really to give our startup companies direct access to our pediatric hospitals who are potential buyers for their solution. So our KidsX champions are clinical, innovation, and IT resources from each of our pediatric hospitals, and they help our companies really nail down their product market fit, figure out how to navigate all of the security and IT processes, vendor selection processes, and procurement processes at our hospitals, and really offer advisory and mentorship opportunities to the companies as they are trying to refine their pitch and really figure out the best way to pilot. And one of the most important parts of our KidsX Accelerator is that our hospitals offer a direct channel to piloting, and most of them make a commitment to pilot with one or more of the solutions that we hope, crossing fingers, ends up resulting in a longer-term commercial partnership. So I will now pass it on to Bianca Riello, to our KidsX Programs Lead, to talk more about the program's success.
Thank you, Kiana, and thank you all so much for joining us today. I'm Bianca Riello, the Programs Lead for KidsX, and have had the privilege to lead this year's Accelerator program and work alongside of the incredible cohort that we have today. As Kiana mentioned, KidsX has been around for 4 years, and in just 4 short years, we've supported 64, let me just advance to the next slide here, 64 alumni companies in 32 active KidsX member hospitals who have pursued a total of 75 pilots overall. So really proud of these milestones that we've been able to garner in the ecosystem in such a challenging environment. We've worked with companies ranging from a variety of disciplines, from patient experience to data and analytics to even wearable and robotics. So really excited to really support a diverse range of portfolio companies. Of course, we've had a number of alumni that have successfully completed milestones, from closing fundraising rounds to successfully pursuing partnerships, winning awards, and all of which we are very excited to announce today alongside of our cohort. So first, Artera is an integrated patient communications platform. They have recently launched the new 3 additional product offerings on top of their existing product. So really excited to announce this. Secondarily, we have Augment Therapy, who is building AR rehabilitation, and they have announced a pilot program with CareSource alongside of Cincinnati Children's, which is a KidsX active member hospital. Diligent Robotics is developing a suite of AI specifically to support robotic tools and interacting with humans in various environments. So specifically, they have implemented their technology at Children's Hospital of Los Angeles and have hit a diverse range of milestones, improving workforce efficiencies in just under 2 years of deployment. Fabric, which is a KidsX 2023 alumni company, has acquired another KidsX fellow alumni giant, as well as MeMD, to really streamline care and triage, and specifically the ED, as well as expanding access to care virtually. Maro is a tool specifically for mental and behavioral health in the schools, uniting schools and hospitals and home. So they've been awarded one of 3 Catalyst 2024 winners, and really recognizing the opportunities in their platform. And lastly, NEN has received an investment from Plug and Play, which is really exciting and representing the opportunity to revolutionize pediatric oncology. And hot off the press, they were also recently, just last night, awarded the Rising Star for the Digital Health Awards in 2024. So incredibly proud to showcase some of these milestones of our alumni alongside of our current cohort. But as we think about our existing cohort, I want to take the opportunity to share more about how we go about effectively sourcing these companies. And as Kiana mentioned, really some of the most unique value of the KidsX consortium is the consortium effect and the ability to unify hospital systems from across the US and internationally to align on the most pressing problems in pediatrics. So these are problems that these organizations are looking to dedicate staff, resources, time to really innovate in these categories, in these areas. And so our core functionality as a team, as it relates to the accelerators, to really uncover what these needs are and effectively source companies to meet those. So every year we align on focus areas that are the prominent driving factor of the applications for our cohort, and that in a sense ultimately guides our selection criteria for the companies. And so today's cohort really represents real world problems that these hospitals are seeing and are the leaders in that domain. So I'm immensely proud to introduce to you all today our 2024 cohort. As I mentioned, we have these 5 incredible focus areas, specifically starting with AI automation, care journey navigation and triaging, health literacy, hospital at home, and mental and behavioral health. So without further ado, I will introduce Nandita Katwani, who's the KidsX Community and Business Development Lead, to further introduce our companies.
Hi, everyone. Thank you for choosing us over Lenny Kravitz. We do appreciate it. So we'll be kicking off with our pediatric mental and behavioral health and health literacy focus area companies. For mental and behavioral health, we were aiming to address planning, monitoring, and wraparound services for pediatric hospitals and patients. For health literacy, we were seeking solutions to address social determinants of health for pediatric patients. So I first welcome Dr. Colin Keeley, CEO of NeuroSigma.
Hello? All right, we're on. You know, I was going to open with a Lenny Kravitz joke, but Nandita stole my thunder on that one, so I will forego. But there we go. So my name is Dr. Colin Keeley. I am the CEO of NeuroSigma, and NeuroSigma is a company focused on pediatric neurodevelopmental disorders. Our lead product is the Monarch ETNS system, which is FDA cleared for treating pediatric ADHD. And the next key steps for this company are to complete 2 large randomized controlled trials of over 450 subjects, launch our 2nd generation product in the United States in the 1st quarter of next year, and initiate additional clinical trials and pipeline indications such as autism and dyslexia. So the problem that we're addressing with our lead product is that of ADHD medications. ADHD is a very large market with over 90 million prescriptions in the United States last year, and it's mostly about 80 to 90% served by stimulants, mostly amphetamines. So these medications can be very effective, and I am not here to say that there's no place for medications in the treatment of ADHD, but that efficacy comes at a cost. Side effects, abuse, and addiction, and in fact, far and away the most common reason that patients forego treatment for ADHD is the side effects associated with those medications. So we offer a fundamentally different and low side effect solution. This is the Monarch ETNS system. It is a home use wearable device with two primary components. The first component is a handheld pulse generator that is connected to a daily disposable electric patch that the patient places on their forehead to administer the therapy. The therapy is administered at night and while the patient is asleep, and when they wake up in the morning, they simply remove the patch and go about their day. So how does this work? The trigeminal nerve is a cranial nerve. It is actually the thickest and one of the most complex nerves in your entire body. So what we've shown via a series of modalities is that when we send a proprietary electrical signal to the V1 branch of the trigeminal nerve, that signal travels down the nerve into the brainstem and then up into higher brain centers. More specifically, we have shown that we can activate people's right prefrontal cortex. And long before NeuroSigma ever came along, the right prefrontal cortex was known to be associated with executive function, attention, and mood, and known to be hypofunctional in people with ADHD. So I think the simplest way to think about this is we're sort of kickstarting people's brains to reestablish a more normal pattern of electrical activity. And this has been validated in open label and double-blind trials at UCLA. Shown here is a responder analysis from the pivotal study that led to our FDA approval. And the bottom line here is that there was a 50% responder rate, and among those responders, there was an average reduction in ADHD symptoms of 44%. Now, probably you don't have a lot of context in the space for ADHD, but that is an effect size on par with best-in-class medications like Vyvanse and Adderall XR, both of which peaked at multi-billion dollars of annual sales. But I mentioned earlier we have 2 additional large randomized controlled trials going. This is so important because the data set that we used to get FDA approval has approximately 100 subjects in it. It's great, it's nice, clean data. But my competitors, pharmaceutical companies, they go to market with hundreds and hundreds of patients. So our commitment is to build a pharmaceutical quality data set of over 500 subjects. And actually, the first of my large double-blind controlled trials is completing next month. That's the trial at King's College of 150 children and adolescents, and we expect data from that in either Q1 or Q2 2025. So we've got the data, we've got the Gen 2 device. How are we going to scale this thing? So we think this is a very scalable product because remember, it is a home use wearable. It is FDA mandated as a prescription product, so we sell it via pharmacies. So we're not a traditional medical device company where we're, dealing with hospital purchasing managers, talking to doctors in the operating room. No, just like a pharmaceutical, we are driving prescriptions at the doctor's office for both the device and the daily disposable electric patch. That gives us a very scalable and high margin business model, and we intend to leverage the KidsX hospital network to drive rapid adoption and awareness as we hit these milestones of the next generation product, the data, and the additional clinical indications. So that's a brief overview of what we are doing. Thank you for your attention. Please feel free to reach out if you have any questions.
Thank you, Dr. Keeley. Next, we welcome Dr. Stephen Moyo, CEO of Wellfy.
Hello, hello, hello. How's everybody doing? I am Dr. Stephen Moyo, CEO and founder of Wellfy, and we are building and empowering the youth health workforce. Now, don't let this youthful face fool you. I've spent over 20 years of my life caring for patients in hospitals. Hospitals such as the Johns Hopkins in Baltimore. And never have I seen what we're facing today. I want to tell you about Maria. a 16-year-old girl who came into my emergency department after taking 60 pills in an attempt to end her life. Maria, an immigrant like myself, was sad because she felt alone and disconnected from family and friends. And she was angry, not because she tried to take her life, but because she did not take enough pills to succeed. I left that room with one thought: she'd be back. Trapped in a vicious cycle of readmission, where I discharge her home for the hospital, only for her to come right back in again. And around this cycle goes, until one day, I discharge a patient like Maria to the morgue. This cycle is driven by a lack of mental health care workers in our communities. Today in the US, we are short over 300,000. And this couldn't be happening at a worse time. We're in the midst of a youth mental health crisis where over 500,000 youth, just like Maria, showed up to emergency departments just like mine. This is costing pediatric hospitals an estimated $2 million each year. And it's frankly because youth like Maria are showing up in the wrong place. They shouldn't be in the pediatric emergency departments. There's better places for them to get treatment. This is breaking our system. Hospitals don't have the workforce in the hospital and even upstream in schools and camps to stem the tide of the youth mental health crisis. And this is why Wealthy is building the youth health workforce, or as I like to call them, the youth force. The youth force are young people who can become credentialed to deliver Medicaid services. It starts with the Wealthy Health Certificate. They can get credentialed through training centers that are local in their region. And ultimately, we want them to launch their career in pediatrics, serving schools, pediatric hospitals, and federally qualified health centers. The youth force are community health workers, behavioral health coaches, and peer counselors. I mentioned they can now bill Medicaid for delivering these essential health education, care coordination services to youth like Maria. This is the workforce that we are building. It starts with the Wealthy Health Certificate. This is an online self-paced course that youth can take to get certified, credentialed, and trained. They can take care of mock patients. We sell this platform for $10 per learner per year. This actually has Pediatric Hospital Foundations very excited. It's an opportunity to expand their brand and show community that they're having impact and listening to communities. Because when we've talked to communities and these hospitals have actually surveyed their communities, lack of a representative workforce is often one of the number one issues that come up. We have hit $400,000 selling this certificate. We've doubled our revenue in the past year. And the best part is we already have $400K locked in for next year as well. What we do then is really unique. The same platform that youth use to train is what they can use on day one practicing as a pediatric mental health provider. So we are empowering this workforce. It starts with the ability to send assessments out to youth like Maria, capturing real-world data about how they're doing. Based on that information, they can then coordinate care via the Well. This is a resource library that we've collaboratively built with youth. It features health education content and sources that youth have co-vetted alongside our health professionals. And so if you're a healthcare provider, part of that youth force, you can send Maria the right resources at the right time. Our ultimate goal and mission is to keep kids out of the hospital. So not only can they send those resources, but they can plug Maria into the right care. I mentioned it's all supported by CPT codes. And this has customers like pediatric hospitals very excited. The youth force is key to breaking this cycle. The readmission cycle costs pediatric hospitals and healthcare organizations over $52 billion each year. And so we're happy to say we completed KidsX Accelerator this summer, and we left with 2 pediatric pilots that we're currently planning. We were invited to Chicago to pitch the Children's Hospital Association, and we picked up a 3rd hospital as well. When we successfully execute against these pilots, we'll be launching Wealthy to the over 300 pediatric hospitals in the US. So please go to youthforce.health or connect with me here today to find out more about how you can empower the youth force. Thank you.
Thank you, Dr. Moya. I need the clicker. Do you want to? It's my pleasure to bring our longtime KidsX sponsor and partner, Cooley LLP, to introduce our last company in our pediatric mental and behavioral health and health literacy focus area.
Hi there. I'm Matt Schwee. I'm a partner with Cooley in our corporate group. Work with a lot of private companies, and we are very proud to partner with KidsX. Cooley is a global law firm with over 1,300 attorneys, and we're focused on working with innovators. We work with over 700 disruptive healthcare companies, and over the course of the past year, handle transactions on behalf of digital health clients, representing over $9 billion in deal value. With that, I'll turn it over to the next innovator here, Aaron Blacker of Teleo.
Thank you, Matthew. Is this on? Oh, cool. When I was in high school, my sister was hospitalized for a psychiatric crisis. As her younger brother, I always felt that we could have intervened earlier. But prior to the pandemic, it was considered clinically irresponsible to do mental health care with kids or teens remotely. So parents like mine with 5 jobs and 3 kids struggled to access care. In a 2-week period in March of 2020, that all changed. In a 2-week period in March 2020, that all changed. Telehealth became parity reimbursed, and access for families like mine became possible for the first time. Today, over 40% of appointments are done remotely. Unfortunately, providers adopted standard corporate video conferencing systems like Zoom and Microsoft Teams as the standard of care, which are constitutionally and fundamentally unengaging to kids and hard to facilitate and exhausting for clinicians. To address this, we built Teleo. Teleo is a pediatric telehealth platform that improves child engagement in therapy and streamlines workflows for clinicians. The Teleo Virtual Therapy Room is an interactive space that contains evidence-based interventions stored within the objects in the room. The clinician and the child can collaborate on web-based or file-based activities without sharing screens, giving away mouse control, sending links, or using a chat, in this case, self-esteem jeopardy. The child can choose the room background, and the participants can seamlessly transition between talk mode and room mode. Clinicians can customize virtual rooms for each child's presenting challenges, age, interests, and culture using our activity bank of 240 categorized resources by approach, in this case CBT, age, in this case 11+, and topic, in this case self-esteem. Clinicians can upload their own interventions, while organizations can have pre-built libraries to scale high-fidelity clinical operations. Rooms can be renamed, saved, opened 15 seconds in advance of a session, improving clinical productivity. Teleo benefits providers and patients in 4 key ways. First, we integrated evidence-based practices into the virtual environment where they are deployed. This improves the ability for clinicians to find resources, saving session prep time, and also improves adherence to evidence-based practices. Second, we make interventions more interactive through 2-way monitoring, eliminating the need for screen sharing and making one-sided activities highly collaborative. 3, Teleo rooms are personalized for each child and can be saved and retrieved before the session using the Teleo Activity Bank. And 4, of course, Teleo integrates AI to provide session insights and take high-quality clinical notes. Clinicians love Teleo. 86% say it improves engagement, 89% would be disappointed without it, and we have a 99th percentile NPS. Patients love Teleo too. 84% of patients between 11 and 19 say that Teleo makes them more excited to attend their next session than Microsoft Teams or standard video. Teleo has onboarded 1,000 clinicians in 2024 and grows 5% weekly through 100% word of mouth. Teleo spent exactly $0 on marketing. Teleo has referenced customers at top providers, including Stanford Children's and Montage Health, in addition to other FQHCs, tech-enabled service providers, and community behavioral health agencies. Plus, we have a $4 million enterprise pipeline, including 2 KidsX hospitals. Teleo can integrate with any provider, and as of May of this year, we're Epic approved and seamlessly integrate with Hyperspace and MyChart. And in addition, we have a $3 million research partnership with Stanford Children's to measure Teleo's engagement and outcomes versus Zoom directly. And finally, Teleo is backed by 3 of the top 10 investors in the world, including Sequoia Capital, Greylock, and Craft Ventures, plus founding team members from GoodRx and Airbnb. Teleo's mission is to make quality therapy accessible to kids everywhere, and we're a public benefit corporation that gives away 1% of profits to further benefit children's mental health. If you are a provider who provides services to kids 5 to 18 and wants to scale the engagement, quality, and accessibility of your care, please contact me directly at aaron@teleo.space. Thank you.
Hello, can you hear me? Great. Thank you, Aaron. In our next focus area, AI and automation, we were seeking technologies that could support workforce optimization, including data entry, documentation, clinical decision-making, hospital operations, and patient insights extraction for pediatric hospitals. To address this area, we first welcome Sarah Wells, CEO of DropStat.
Is this better? Okay. Hello?
We're losing track of the mics.
Oh, it's good. Is this on? I can yell. Is it on now? Okay, awesome. We are on the verge of a public healthcare crisis. 500,000 nurses have exited the industry due to COVID fatigue, and 2 million more are aging out within the next 2 years. That's a net loss of 38% of the labor operating arm of medicine. That's going to have a massive impact on our ability to provide safe care and affordable care. In pediatrics, this means massive capacity issues. And in elder care, this means that we may have to divert patients to further away hospitals than their local treatment centers. And as you well know, not many people have the gift of time when we're critically ill. I know this problem all too well because I spent 12 years working critical care trauma as a direct care nurse. And as I worked my way up to becoming a staffing manager, I could not believe that we had gamma knife surgery upstairs and we had minimally invasive robotics downstairs. And I'm manually calculating my patient acuities so that I can figure out, I see so many people nodding in the audience, my technology was a pen and paper. And I'm deciding if the hospital goes on divert. That means if we have to send a patient who's possibly having a stroke to a hospital that's further away, and time is brain. My process was so highly manual that I was also calling and texting staff to see if they can come into work. We have facial recognition software in Macy's, and this is my process in some of the best capitalized hospital systems in the US. In fact, we needed so many rapid solutions that we were blindly running to agency and travel staffing solutions, running through our entire workforce budget, and we couldn't then even afford to engage and retain our existing staff. So we were constantly in this rut of overspending and understaffed. I needed a solution that could predict my staffing needs in advance. There's many things that people do really well: assessments, communication, therapeutics, but there's some things that machines do really well. And predicting our staffing needs was just a technological deficit. I needed something that could communicate with all our staff across sister facilities, across the hospital that's 20 minutes away that we're partnered with, across every single department and silo, to make sure that I have reached every single staff member who's possibly trained to work a shift. And I didn't have that technology. And that's why I built DropStat, to help our organizations stay solvent, to save us time and to save us money, and to hopefully save lives. Something that many people don't know about current solutions in this space is that they're highly manual, kind of like an automated spreadsheet. Maybe if they're super technologically advanced, they can communicate open shift needs to internal staff members on the same unit. And then if they're even more advanced, you can click into a shift that's understaffed and use an API to send it out to some sort of Uber for nurses type solution. Now let's look at DropStat. We're able to predict your staffing needs 90 days in advance. Everywhere you see a yellow arrow, that's a process automation. We're able to have embedded acuity and what's called HPPD calculators in our platform. Our system self-generates its own schedules. It self-generates the communication of open shifts to internal staff, to cross-trained teams, across departments, across silos, across partner facilities. We have 20x the size of the team that we're communicating your shift needs to. And in fact, we have automated decision support. And we can ensure that every single shift is filled autonomously with the safest and most cost-efficient person available at scale. And because we're filling shifts so early, we now have the ability to forecast costs instead of a retroactive, oops, where did we mess up? Our platform is so user-friendly and simple and easy to understand that we barely need any training time on the staff side, and it's 1 hour of training on the manager side. And we're already integrated with all the payroll solutions and the HR solutions, and we can go live in 48 hours. Since our KidsX partnership, we've been able to increase shift fill rates by 35%, decrease the use of agency and travel staffing by 50%. And our ROI ratio is $15 saved for every $1 spent on DropStat. Since our partnership with the KidsX program, we have 2 hospitals on our platform now, with 2 more large integrated health systems in the funnel, and we have 168 facilities live with 220 contracted and ready to onboard. Our team is made up of leaders in this industry who have scaled healthcare-related organizations and solutions to liquidity and to acquisition events. And we're excited about the future of staffing. Thank you.
I think we've got the mics right this time. Thank you, Sarah. Next, I welcome Kanishka Rao, COO of Caregnostics.
How's everyone doing? It's hard to hype up a crowd before you talk about undiagnosed chronic diseases. We're talking about some serious stuff. But I'm Kanishka Rao. I'm one of the co-founders of Caregnostics. And I started the company a couple years ago after an unfortunate event. My grandfather, unfortunately, passed away from undiagnosed kidney disease, but didn't find out about his chronic kidney disease until his kidneys failed. And it was this moment that clued us into just how many patients, unfortunately, end up in this situation, where they find out about their condition too late, once the preventative interventions are no longer effective. And it's for this reason, me and my dad, who's my co-founder, teamed up to found Caregnostics. And we've assembled a team of some of the pioneers of healthcare AI to really tackle the problem of how can we identify these high-risk populations earlier. We've been fortunate to be recognized with some of the awards, including last year winning Best Use of AI and Health Tech Rising Star here at Health. But what I'm proudest of is we're actually driving real clinical impact, translating AI predictions actually into actionable insights and intervention on these patients. Very excited here to be announcing our foray into pediatric care and actually doing this on the population that has the most opportunity for preventative intervention, kids, if you get them earliest on in their journey. So excited to share with you some more about that. Just at the highest level, what we do is we think to solve this problem with AI and actually make clinical AI usable and affecting outcomes, you need to actually have an end-to-end approach to it. So this includes, obviously, the first step of let's identify this population, but equally important is having the interfaces needed for the physicians at the point of care to be able to intervene on this population earlier, as well as expanding the clinical capacity by getting all the other users in the healthcare ecosystem, all the other care teams involved, the care coordinators, the clinical pharmacists, the PCPs, everyone performing at top of license to expand the capacity to actually take on this challenge. But I'll move past the theoretical stuff and actually give you a case example of how we did this. So one of the populations we tackled to move into pediatrics was severe asthma. Specifically, this is the 6% of asthmatics that drive 50% of the hospitalizations. So referencing back to the previous slide, the first step was let's identify this population. And what we did is we learned an AI model on the existing clinical data as well as all the external data sources to identify these patients at highest risk, which were the pediatric patients that were most likely to exacerbate due to severe and uncontrolled asthma, and fortunately achieved an 85% positive predictive value. Essentially, physicians agreed with the patients we identified more than 85% of the time were patients that they needed to take a closer look at for their asthma care. Now, what I'm proudest of, though, is making this actionable. And so this includes, as alluded to, different solutions for different stakeholders in the ecosystem. For example, for the population health teams and care coordinators, what you want to do is give them a simple dashboard that illustrates the gaps in care so that they can identify, these are the patients that we need to actually step up or get referred to specialty care or take another look at due to uncontrolled exacerbations. Then similarly, for the physician at the point of care, it's a very different solution. This, say, pulmonologist wants a view of all the relevant clinical data in the record. Essentially, what's the exacerbations? What are the medications they're already on? What are the lab values? Giving them a better view of all the relevant information they need to actually evaluate, understand the patient's severity, and intervene on this population earlier. The results have been phenomenal in this. Not only did we identify an order of magnitude more patients, but we actually succeeded in doubling the rate of treatment on this population per guidelines, expanding the number of patients getting on the preventative care they needed. And we did this while actually saving physicians time in their workflow. With that one-page summary, we were able to pull together all the data that they often have to spend time digging around for to get a complete longitudinal view of the patient's situation. And it's this comprehensive approach that's driven this. The best compliment I got was the chief clinical officer at the health system said, "This is the first clinical program I've ever rolled out where I heard nothing from physicians. And physicians not complaining is the best compliment I can give you." And so that's what we're proudest of, actually making this usable and making the end users love using it, because we're helping them deliver the care that they already want to deliver and empowering them with the tools and technology to do so. So, and we've published these results both in CHEST and the college coming up this week of asthma and immunology. For Caregnostics, though, we've built a platform to go across diseases, and we see this as the tip of the iceberg of what we can do and where we can go in not only adult but pediatric conditions as well, getting into things like diabetes and mental health. But the KidsX program has been phenomenal in accelerating our foray into pediatrics. We're excited to be in active conversations with some of the leading children's hospitals in the country and really looking to you. What are your top priority areas? We would love to partner to figure out how we can improve the outcomes of the patients who need it most. Thank you. Thanks, man.
Thanks, Kanishka. In our next focus area, hospital at home, we were seeking technologies to support early discharge and/or acute pediatric patients. I would like to welcome Jonathan Bout, CEO of Gabby Smart Care.
Can you hear me well? Yeah, looks great. Well, thank you everyone for being here. I'm actually very excited to introduce you to Gabby SmartCare. Gabby has built, I'm sorry, where's the, okay, there we go. You had one slide. There you go. So Gabby SmartCare has built the very first remote patient monitoring platform and actually device exclusively for pediatrics, for kids. The company has been recognized by a series of leading organizations such as BARDA, the European Commission, as well as Johnson & Johnson, for the work that we're doing to improve healthcare for pediatrics. As you know, RPM has really changed the way we care for people. Like, it really accelerated the transition of care to home, right? And now studies shows that we can actually reduce cost, but also improve clinical outcomes. But here is the catch. This is essentially true for adults. When it comes to kids, it's still very underrepresented in there. And Gabby is definitely here to change that. Some of the most innovative hospitals in the space right now have put together some remote patient monitoring programs for kids. But the thing is, they didn't have access to the right tools. So right now, they do rely on devices that are bulky, that are not connected, that are wired. And despite of that, these programs actually show encouraging results. But we know we can do so much better, right? So right now, these medical teams, they have to take clinical decisions on only one data point per day, for example. And they have to chase parents to collect these data. And when there is something wrong with the child, the parent needs to rush to the hospital with their child just to figure out what's happening. And bear in mind that this sometimes means that they have to drive several hours to reach a hospital, right? Obviously, that process is totally inefficient. It's actually stressful. And again, we know we can do so much better. And this is why we build Pediarity. That remote patient monitoring platform actually automates this monitoring process, streamline data transmission to providers. We are using a proprietary medical wearable band, which is monitoring the main vital signs of the child, such as SpO2, heart rate, movement as well. Then we have this centralized platform, which is collecting all these data in real time and push all the data to a dashboard that is dedicated to providers, right? Well, they can actually have a comprehensive health assessment report of the child. So if we apply that to our use case, what it means is that providers now don't have to rely on only one data point per day, but they have actually access to thousands of data points per day. And these thousands of data points per day are viewed in a way so they can have a comprehensive health assessment of the child in less than 60 seconds. That process is completely integrated, automated, and that saves valuable time to the providers. Gabby addresses three critical challenges for healthcare organizations. First, we improve the access to care by providing, for once, specifically designed tools for children that are easy to use at home. So we have very qualitative data and continuous data as well. These data then enables timely intervention, which improves quality of care. And if we can have timely intervention, then obviously we decrease ER visits, we decrease readmissions, we decrease preventable hospital admission, so we decrease costs. Today, the solution has been deployed in 40 different hospitals worldwide, including 31 hospitals in the US, essentially for research applications, as we didn't have the FDA clearance. Now that we have the FDA clearance, we are actually moving to clinical applications with 9 different hospitals, including 4 hospitals from the KidsX Accelerator. So we currently we are in strong discussions with primary children from Intermountain, with Children Nebraska, as well as with Mary Bridge from Multicare. Behind Gabby SmartCare, we have a very strong team capable with track records to build strong technology, commercialize healthcare products, as well as in regulatory affairs. We also have a very strong team in the leadership team that are having a track record in building and scaling up tech and medtech companies. And we're also supported by doctors that are making sure that we remain focused on delivering the best value for patients and the best value for healthcare providers. So as you understood, Gabby SmartCare's mission is here to really accelerate the care to home by providing the best technology possible to the child. And if you share that passion with us, we're just more than happy to just catch up after the session or later on, exchange ID, explore collaboration, whatever. We'll be happy to continue the discussion. Thank you.
Thanks, Jonathan. Our final focus area, care journey navigation, we focused on solutions for pediatric hospitals and emergency departments to support the patient and caregiver experience. We'd like to welcome Phil Marty, CEO of Nicolette.
Okay, hello everybody. So I'm Phil, I'm the CEO and co-founder of Nicolette. And we make software for kids and their parents that put them at the center of care and turn them from freaked out bystanders on the outside looking in to competent members of their own care team on day one. And we're starting in the NICU. Now, NICU parents are a great place to start because they are truly disenfranchised people. They're true outsiders looking in. They are those people who are freaked out at the beginning and don't know what to do. I lived this firsthand. So my wife and I welcomed 25 weekers a few years ago. That's 3.5 months early. So a pound each, very sick, a lot of things to overcome if they were going to survive and thrive. And for the first time in our lives, we knew what it was like to be helpless. Because while in the NICU there's amazing medical device technology, there's an absence of tools for parents to navigate the journey. So for us and parents across the spectrum, what happens? We make decisions that we would do differently just a short time later. We miss opportunities to participate in a hands-on way that we would have taken if we just knew what to do and had the confidence to do it. And of course, we sign all kinds of consent forms that we don't really understand. So our first product is called NicoBoard. It addresses this and empowers parents to be competent team members on day one in 3 important ways. The first is by transforming raw EHR data into conversational updates and insights that are super easy to consume and understand. Visuals that are interactive, that allow parents to drink in loads of data points really quickly and then apply that to care. Next, curated education, tailored to the baby, one-to-one. It's evidence-based, it's up to date, and it solves the issue of there being too little education at the point of care, at the bedside. But at the same time, if the parents go to the internet, there's way too much information that's actually counterproductive if they try to apply it. And then lastly, participation tools. Super important for them to be hands-on in care. But how and can I do it? We give them instructions, encouragement, and then tools like the diary. It's glitching a little bit there, but that let them get joy back in the experience of being a parent that's otherwise stripped away by the NICU experience. Now, it's probably pretty obvious that this kind of a tool is a great parent satisfier, right? Their experience will get exponentially better. But it's also true that this is a great economic benefit to both payers and providers. First of all, babies hit their milestones sooner when the parent is competently involved. So they will go home sooner. Length of stay goes down. Readmissions down. At the same time, clinical productivity is way up because there's a new team member on the care team who's focused just on this baby. Now, KidsX was a really successful partnership for Nicolette, and we're really happy about the progress we made. And the biggest thing about it is execution. Innovation, most of the time, is a lot of talk, but truly it's not happening unless there are health systems that raise their hand and say, we will do this thing first. Doesn't matter if anyone else has done it. We know it's risky, we'll still do it. At the same time, startups like us need to be exposed to those kinds of institutions that know they have our back and they're rooting to succeed. And KidsX brings those two groups together, and not just matchmaking, but like the tools, the processes that need to occur to like make it happen. So we're working with some great institutions that are KidsX members, you can see here, and we're really happy with what we were able to achieve. So thanks very much.
Thank you, Phil. That concludes our 2024 KidsX Demo Day. I want to extend a sincere thank you to our cohort for being here today and showcasing the incredibly impactful work that each of you is doing. I welcome the audience to scan the QR code to connect with our cohort, connect with our team if you'd like to learn more and get in contact with them. Also want to extend a sincere thank you to our sponsors and partners. KidsX truly could not execute our various innovation programs and accelerators without their tremendous support. Also want to announce an exciting new partner, CancerX. We are really excited to partner with this organization who's really pioneering the acceleration of oncology technology and developments in the space. We are very happy to dedicate 2 spots in their upcoming accelerator towards pediatric oncology. So the applications are officially open for that program. We welcome you all to learn more, apply, and reach out to us for more information. And lastly, if you'd like to get involved in the mission of advancing pediatric care, please don't hesitate to reach out to our team directly here. We would welcome you with open arms as a hospital partner, investor, other collaborators. So thank you so much and enjoy the rest of the conference.